Good afternoon, everyone. The topic for today's class is General Epidemiology Part 2. We'll continue with the topic. The contents are Introduction, Classification of Analytical Epidemiology, which includes case control and cohort study, matching, bias, randomized control trial, blinding, and references. Coming to the introduction, analytical epidemiology is the second major type of the epidemiological studies. In contrast to descriptive studies that look at entire population, in this the subject of interest is the individual, and it is there not to formulate but to test the hypothesis. It is of two types: case control study, also known as retrospective study, and second is the cohort study, also called as the prospective study. Coming to the first study design, that is the case control study. It involves two population cases and control. The focus is on the disease or health problem. The cases and control must be comparable with respect to the known confounding factors like age, gender, etc. In this, both exposure and outcome have occurred before the start of the study. The study proceeds backwards from effect to cause, and it has a control group to support or refute an inference. So this is the framework for the case control study. This is the same study design, how we select the cases and control. The steps involved in the case control study, there are basically 4 steps which we will talk about in detail. First is the selection of cases, which includes the diagnostic criteria and eligibility criteria. The diagnostic criteria of the disease and the stage of the disease should be specified. The eligibility criteria employed is that the newly diagnosed cases in a specified period of time are eligible than the older cases or the advanced stages. The sources of cases can be hospital, private clinics, or general population. Selection of controls, they should be free from the disease under study, similar to cases as possible. Difficulties can arise if the disease is in the subclinical form. So sources can be hospital, relatives, neighborhood, or general population. Confounding factor is the one defined which is associated with both exposure and disease, and it is distributed unequally in the study and control group. Example, smoking and age. Matching. Matching is defined as a process by which we select the control in such a way that they are similar to cases with regard to certain variables which are known to influence the outcome of the disease and which, if not adequately matched or compared, can confound the results. So suspected etiological factors should not be matched. Matching may be done on individual basis or group basis. If it is over them, it can be difficult to find the controls. Third step is the measurement of exposure, which is obtained by interview, questionnaire, or past records. Clinical or laboratory examinations can be carried out. And the final step is the analysis, which is done to find out the exposure rate. And second is the estimation of the risk, that is the odds ratio. So this is the formula for the calculation of the exposure rate, that is A upon A plus C in the cases. And for controls, it is B upon B plus D. The relative risk, the formula is incidence among exposed divided by incidence among non-exposed. Odds ratio, it is a measure of strength of association between the risk factor and outcome, which is equal to AD upon BC. Bias in case control study. Bias is any systematic error in the determination of association between the exposure and disease. The relative risk estimate may increase or decrease a result on the basis of the bias. So bias can be of different types, like bias due to confounding, memory or recall bias, selection bias, Parkinsonian bias, and interviewer's bias. Indications of case control study in the chronic disease problem, mainly. Coming to the advantages, it is easy, rapid, inexpensive, fewer subjects, suitable for rare diseases, no risk, several factors can be studied, no attrition problem, and ethical problems are minimal. Disadvantage is the problem of bias, selection of the control group, and we cannot measure the incidence. These are the certain disadvantages of the case control study. Coming to the second study design is the cohort study. In epidemiology, cohort is defined as a group of people who share common characteristics or experience within a defined period of time. The indications is when we have to measure the association between exposure and disease. This is the main indication. This is the framework for the cohort study. It is of mainly three types: prospective study, retrospective, and combination. Coming to the elements of cohort study, these are five which we will talk about in detail. So first is the selection of the subjects, which can be done in two ways: general population or special groups can be there. Second is obtaining data on exposure, which can be obtained through the cohort members, review of records, medical examination, or environmental survey. Selection of the comparison group is done by internal comparison, external comparison, and comparison with the general population. Next step is follow-up, which includes periodic medical examination, reviewing physician and hospital records, routine surveillance, and mailed questionnaire, telephone calls, or the home visits. And last step is the analysis, which includes calculation of the incidence rate and estimation of the risk. So this is the same with the help of the example, how we calculate the incidence rate. Risk, we calculate the relative risk, which is equal to the incidence among exposed divided by incidence among non-exposed. And attributable risk, the formula is incidence of among exposed minus incidence of among non-exposed divided by incidence among exposed into 100. So this is the calculations, how we calculate the rates. The bias that occurs in the cohort study are in assessment of outcome, information bias, bias from non-responses or loss of follow-up, and analytical bias. Advantage is that incidence can be calculated. We have several possible outcomes. They have direct estimate of the relative risk. The dose response ratio can be calculated and comparison groups can be formed. The disadvantages is that it has a large number of people, long time, administrative problems, and there can be some changes in the standardized methods. They're expensive. They can alter behavior. Ethical problems can be a concern. So these are the certain differences between the case control study and the cohort study. Now coming to the last type of the study design, that is the experimental epidemiology, also known as the interventional studies, in which we give intervention or manipulation, deliberate application or changing variable in the experimental group, direct control of the investigator, observation and comparing the outcome of the experiment in both the groups is being done. So experimental studies are basically of two types: randomized control trials and the non-randomized trials. So first we'll talk about the randomized control trials. So RCTs, they are used for evaluating both the effectiveness and side effects of new types of interventions. The design is used for the new treatment modalities, including new health and medical care, technology, organizing, and delivering the healthcare services. The steps involved in the randomized control trial are drawing up of the protocol, selection of reference and experimental population, randomization, manipulation or intervention, follow-up, and assessment of outcome. So this is the study design for the randomized control trial, that firstly we have to select a suitable population from which we will select the experimental or the study population defined by the specific criteria, in which we have the participants. We will randomize them into two groups, the experimental group and control group, after which the manipulation or intervention will be given to the participants. Then a follow-up of the participants will be done, and then the assessment of the outcome to get the results. Blinding, in order to remove the bias, blinding is done, which can be of three types: single, double, and triple blind trial. In single blind trial, the participants are unaware of the group. In double blind trial, investigator and participants are unaware. And in triple blind trial, participant, investigator, and person analyzing the data are all blind. So the randomized control trial study can be of different designs are there. Parallel designs, in which two parallel groups are there. The therapy is given and comparison is being done. And second is the crossover study design, in which each person will act as their own control. Then the types of RCT are also classified as clinical trials, preventive trials, risk factor trials, cessation experiment, trial of etiological agents, evaluation of health services, and community intervention trials. So these were all about the different study designs. These are some of the textbooks which can be referred for the further reading. Thank you.